Iron. It's not just a metal, it's a cornerstone of a healthy body. We often hear about iron, but why is it so important? Imagine tiny delivery trucks carrying precious oxygen throughout your body. That's what iron does. It helps create hemoglobin, a special protein in red blood cells. These cells act like those delivery trucks, carrying oxygen from your lungs to every corner of your body. Without enough iron, our bodies can't produce enough hemoglobin. This leads to a condition called iron deficiency, which can significantly impact our energy, vitality, and overall well-being. Think about how a car sputters and stalls without enough fuel. That's similar to what happens to our bodies without enough iron. Iron's role goes beyond oxygen transport. It's a key player in cell growth and development, making it particularly crucial during childhood and pregnancy. Iron also supports a healthy immune system, helping our bodies fight off infections and stay strong. In the following sections, we'll delve deeper into the signs of iron deficiency, explore the causes, and equip you with practical strategies to boost your iron levels and reclaim your vitality. Also, be sure to subscribe to the channel to keep up on new content. One of the most common signs of iron deficiency is fatigue. But this isn't just about feeling a little tired after a long day. We're talking about a persistent, overwhelming exhaustion that interferes with daily life. If you find yourself feeling constantly drained even after a good night's sleep, it might be time to consider your iron levels. Another common indicator is paleness. Take a look at your palms, your nail beds, and the inside of your lower eyelids. Do they appear unusually pale? This paleness, known medically as pallor, happens when there's not enough iron to produce the hemoglobin that gives our blood its red color. Shortness of breath is another red flag. If you find yourself gasping for air after climbing a flight of stairs, or doing simple activities that you could handle easily before, it could be a sign that your body is struggling to get enough oxygen due to low iron levels. Remember, these are just a few of the common signs. Iron deficiency can manifest in various ways, and what might be a minor annoyance for one person could be a significant symptom for another. While fatigue, paleness, and shortness of breath are some of the more well-known symptoms of iron deficiency, there are other, often overlooked signs that can point to low iron levels. Do you experience frequent headaches, especially ones that seem to linger? Iron deficiency can reduce oxygen flow to the brain, triggering these throbbing headaches. Dizziness, especially upon standing up quickly, can also be linked to low iron levels. Have you noticed a change in your nails? Brittle, spoon-shaped nails that break or chip easily can be a sign of iron deficiency. This happens because iron is essential for healthy cell growth, including the cells that make up our nails. Another unusual symptom is pica, a condition characterized by cravings for non-food items like ice, dirt, or clay. While the exact link between pica and iron deficiency is not fully understood, this unusual craving is considered a potential indicator, especially in pregnant women. Iron deficiency doesn't discriminate. It can affect anyone. However, certain groups are more susceptible due to factors that increase their iron needs or hinder iron absorption. Women who experience heavy menstrual periods are at a higher risk of iron deficiency. This is because they lose a significant amount of blood and therefore iron each month. Pregnant women also have increased iron requirements to support the growth and development of their babies. Infants and young children, especially those who are picky eaters or rely heavily on cow's milk, may not be getting enough iron from their diet, putting them at risk of deficiency. Vegetarians and vegans need to be particularly mindful of their iron intake, as plant-based iron is not as easily absorbed as iron from animal sources. Certain medical conditions such as celiac disease, Crohn's disease, and ulcerative colitis can interfere with the body's ability to absorb iron from food, increasing the risk of deficiency even with a healthy diet. Section 5. When to see a doctor, getting tested for iron deficiency. If you suspect you might be iron deficient, it's crucial to consult your doctor. Self-treating with iron supplements can be risky, as excessive iron intake can have adverse effects on your health. Your doctor will assess your symptoms, medical history, and dietary habits. To confirm the diagnosis, they'll likely recommend a simple blood test. This test measures different components of your blood, including hemoglobin. This is the protein in red blood cells that carries oxygen. Low hemoglobin levels are a key indicator of iron deficiency anemia. Hematocrit This measures the percentage of red blood cells in your blood. Like hemoglobin, low hematocrit levels can indicate anemia, ferritin. This protein stores iron in your body. Low ferritin levels indicate low iron stores, even if your hemoglobin and hematocrit levels appear normal. Based on the test results, your doctor will recommend the most appropriate course of action, which may involve dietary changes, iron supplements, or further investigation to rule out other underlying medical conditions. Section 6. Iron-rich foods power up your plate. One of the most effective ways to boost your iron levels is by incorporating iron-rich foods into your diet. And the good news is you don't need to overhaul your entire eating plan to make a difference. Small, consistent changes can make a big impact over time. When it comes to iron, there are two types: heme iron and non-heme iron. Heme iron, found in animal products, is more easily absorbed by the body. Red meat, especially lean cuts of beef, lamb and venison, are excellent sources of heme iron. Poultry, like chicken and turkey, and fish, particularly shellfish like oysters, clams and mussels, are also good sources. Non-heme iron, found in plant-based foods, is not as readily absorbed. However, don't let that discourage you. By combining these foods strategically with vitamin C-rich foods, you can enhance the absorption of non-heme iron. Leafy green vegetables like spinach, kale and collard greens are packed with non-heme iron. Beans and lentils, such as kidney beans, black beans and chickpeas, are also good sources. Section 7. Boosting absorption, getting the most out of your iron intake. Timing is everything when it comes to maximizing iron absorption. Pairing iron-rich foods with vitamin C-rich foods can significantly enhance the body's ability to absorb non-heme iron. Think of vitamin C as iron's best friend, helping it get absorbed and put to good use in the body. Squeeze some lemon juice over your spinach salad, toss some bell peppers into your lentil soup, or enjoy a glass of orange juice with your fortified breakfast cereal. These simple combinations can make a big difference in your iron levels over time. On the other hand, certain foods and beverages can inhibit iron absorption. Calcium, commonly found in dairy products, can interfere with iron absorption. If you're enjoying a meal rich in iron, try to consume dairy products separately. Tannins, found in tea and coffee, can also hinder iron absorption. It's best to avoid consuming these beverages with meals, especially those rich in iron. If you enjoy a cup of tea or coffee, try to have it between meals rather than with your food. Section 8. Supplementing smartly, iron supplements and you. While dietary changes are the first line of defense against iron deficiency, iron supplements may be necessary in some cases, especially if your doctor determines that your iron levels are significantly low. However, it's crucial to consult your doctor before starting any supplements, as excessive iron intake can be harmful. Iron supplements come in various forms, including tablets, capsules, and liquids. Your doctor will recommend the most appropriate type and dosage based on your individual needs and health status. It's important to follow their instructions carefully and not exceed the recommended dosage. Iron supplements are best absorbed on an empty stomach. However, they can sometimes cause stomach upset, in which case you can take them with a small amount of food. Avoid taking iron supplements with calcium-rich foods or beverages, as calcium can interfere with iron absorption. Section 9. Staying iron strong tips for long-term health. Maintaining healthy iron levels is an ongoing journey, not a destination. By incorporating iron-rich foods into your diet, being mindful of food combinations, and seeking medical advice when needed, you can support your body's iron needs and enjoy the vitality that comes with it. Here are some additional tips to help you stay iron strong. Cook in cast iron cookware. Cooking acidic foods like tomato sauce in cast iron pots and pans can increase the iron content of your meals. Get regular exercise. Physical activity, even moderate intensity exercise like brisk walking, can help improve iron absorption. Don't ignore fatigue. While fatigue can be caused by various factors, persistent unexplained tiredness should always be checked out by a doctor to rule out iron deficiency or other underlying medical conditions. Remember, taking care of your iron levels is an investment in your overall health and well-being. By making simple yet impactful changes to your diet and lifestyle, you can fuel your body with this vital mineral and live your life to the fullest.